assessment. Action-backed system of empirically based assessments, ASEBA, offers a comprehensive approach to assessing adaptive and maladaptive functioning. Developed through decades of research and practical experience to identify actual patterns of functioning, the ASEBA provides professionals with user-friendly tools. Neuropsychology 2 NEPSY-2 to assess neuropsychological development in clinical and school-age children ages 3 to 16. It is useful for aiding in diagnosis and intervention planning for particular disorders, including ADHD and LD. The NEPSY-2 is useful for general assessment, diagnostic assessment, selective assessment, and a full assessment in a neuropsychological examination. Bender Gestalt 2, Bender Visual Motor Gestalt Test, measures visual motor integration skills in children and adults ages 4 to 85. The instrument is used in educational, psychological, and neuropsychological assessment. The Bender Gestalt 2 is a clinical tool for measuring visual motor behavior, psychopathology, and normal abnormal function 18 years and older is the Minnesota Multiphasic Personality Inventory 2. Minnesota Multiphasic Personality Inventory Adolescent is recommended for adolescents ages 14 to 18. Original research and behavior with the in the behavior with the Minnesota Multifaceted Personality Inventory adolescents was conducted with borderline, depressed mood, eating disorders, homicidal behavior, manifest aggression, victimization by incest and sexual abuse, sleeping problems, physical disabilities, and schizophrenia. Has been researched in psychiatric settings, medical problems, alcohol and drug treatment centers, and in correctional juvenile programs. Million Clinical Multi-Axis Inventory MSM Multi-Axis Inventory 2-3 provides support for the opinions of mental health professionals in clinical counseling, medical, forensic, and other settings. It was designed to measure personality traits and psychopathology and used for clinical decision making. There are 24 clinical scales clustered into four groups: personality scales, severe personality scales, clinical syndrome scales, and severe clinical scales. The MAPI is an adolescent and counseling inventory and recommended for ages range 9 through 12. The pre-adolescent inventory and the adolescent inventory for age range 13 to 19 or additional forms. Positive effects and negative effect scales. PANA scales, considered a mood questionnaire. The characteristics of positive affect PA are high energy, high energy, enthusiasm, and full concentration, active and alert. Negative affect characteristics may be distress in the form of anger, contempt, disgust, guilt, fear, and nervousness, as well as possibly a lack of coping skills. The positive effect and negative effect scales PANAS-X is a 60-item expanded version. The norms include adults and psychiatric populations. Clinician Administered Post-Traumatic Stress Disorder Scale CAPS, considered one of two instruments most commonly used for assessing post-traumatic stress disorder diagnostic accuracy. The Clinician Administered Post-Traumatic Stress Disorder Scale for DSM-5 is considered the gold standard. The CAPS assesses for 20 DSM-5 post-traumatic stress disorder symptoms. The items focus attention to the onset and duration of symptoms, subjective distress, and impact of symptoms on social and occupational functioning. Post-traumatic stress disorder checklist. Self-report checklist of 17 items measuring for symptoms and criteria B, C, and D. There are three versions of the PCL. The PCL-M military, PLCC civilian, PLCS specific. A critical review of the PCL was conducted by McDonald's and Calhoun, who found the PCL to be the most frequently used self-report. The self-report items are to be responded for the past month and on an ordinal scale of 1, not at all, to 5, extremely bothersome. Beck Discretion Inventory BDI-2 is a 21-item self-report inventory that measures the severity of depression in adults and adolescents 13 and older. The inventory is composed of symptoms intended to assess the criteria for diagnosing depressive disorders. It is not an instrument strictly for diagnosing clinical depression. Rather, according to the authors, it can be used for assisting in diagnosing disorders from panic disorder to schizophrenia. Burke's Behavior Rating Scale, BHRS, Revised Burke 2008. The purpose of the XXX is to diagnose children and adolescents age range 4 to 18 with behavioral problems. The XXX scales include disruptive and emotional scales, social withdrawal, ability deficits, physical deficits, and weak self-confidence, and attention and self-control problems. Parent and teacher forms are available. System Checklist 90S CL-90.R. The XXX measures change in outcome studies and screens for mental disorders and integrates data into the interview. Indicated is a widely used symptom inventory, has been researched with clinical trials. Norms are available for adult psychiatric outpatients, adult non-client, adult psychiatric inpatients, and adolescent non-patients. Frequently, the client has provided stimuli of distress, unsure why they are there, and indicates a desire to free the self of the burden. Elicits information regarding psychological distress and psychopathology. Caseness is based on the number of symptoms and endorsement by the respondent. The Substance Abuse Self-Screening Inventory SASI-3 is a structured self-report and screens for substance-dependent disorder. The adolescent version of this Substance Abuse Social Inventory Training A2 is for ages 12 through 18. It's designed to provide a probability for substance use disorder. The SASI-3 was the most widely and important used instrument by addiction counselors. The Structured Clinical Interview SCID-I and the SCID-2. The SCID-2 was originally developed during the time of the DSM-3R and utilized for personality disorders, while the SCID-2 structured clinical interview version 1 was for clinical disorders such as those intended by the DSM-IVTR. There is also a children's interview, DISC-2. The SCID-2 has three components: an interview portion for 11 personality disorders, categories of depressive personality disorder, and passive aggressive personality disorder. It can be used as a screening tool. Bipolar Spectrum Diagnostic Scale, BSDS. Description: a narrative-based self-report developed by Dr. Robert Pies and revised by Dr. Nasir Ghani in 2005. Results are designed to determine the presence or absence of a bipolar disorder in individuals ages 5 to 17, and the triaxle bipolar spectrum screening quiz is for individuals 18 and over. The first part is a story of positive statements in which the individual checks of whether or not he/she believes the statement is true for them. The second part of the instrument is a single multiple choice question asking the individual to rate how well the story represents them overall. Mood Disorder Questionnaire (MDQ) screening is a single report. It is an easy-to-use screening tool for the detection of bipolar 1 disorder. Develop the questionnaire. The MDQ has three questions, each of which is subdivided into a number of questions, such as 13 for the first set of questions. The authors indicate that MDQ is not used for monitoring for improvement. The signs and symptoms for a bipolar disorder include depressed, hyperactive, insomnia, mood swings, anxious, irritable, delusional, paranoid, low energy, fatigue, unable to focus, alcohol substance abuse, legal problems, impulse control problems, and no complaints. The clinician should inquire about past episodes of mania, hypomania, and mood swings. The drug abuse screening test DAC 10, 20, and short Michigan alcoholism test SMASH. Doctors and counselors to determine if an individual is reflecting symptoms of an addict often use the drug abuse screening test DAS and the short Michigan alcoholism test SMASH for adults involved with drugs, specifically for adult and female drug users. It attempts to identify individuals with drinking problems. Has 28 items requiring the respondent to answer yes or no. A score of 5 or less indicates a normal score, while 6 or higher indicates a drug problem. The Dissociative Experiences Scale DES. The DES is a self-report screening instrument for the identification of clients at high risk for dissociative disorders, especially dissociative identity disorder. The DES Dissociative Experiences Scales is used to tandem with the Structured Clinical Interview SCID-D. The DES is a 28-question self-test. The SCID-D is the uh, is the first diagnostic instrument developed for the assessment of dissociative symptom areas. An adolescent version of the dissociative experience scale is the adolescent dissociative experience scale too. Four popular post-traumatic stress disorder scales: 102 inventories, 81 adult, 21 child adolescents, and reported that the four most popular for clinical use include: 1. Post-traumatic stress diagnostic scale (PDS). The PDS is a 49-item self-report measure that assesses for all symptoms of DSM um, 4 criteria AF. The assessment is for the past 9 months. Life Events Checklist. The LEC was updated in the LEC 5. The LEC 5 was updated to meet the criteria for post-traumatic stress disorder criteria A. The LEC 5 is a self-report that screens for traumatic events during a lifetime. The client responds to 17 items about things, events that happened to them. The responses include A. Happened to me. B. Witnessed it. C. Learned about it. D. Part of my job. E. Not sure. And F. Doesn't apply. There are three formats: standard self-report, extended self-report, and an interview. Detailed assessment of post-traumatic stress. Detailed assessment of post-traumatic stress. The DIP is a 104-item measure that assesses for trauma exposure and post-traumatic stress. The symptoms measured are for intrusion, avoidance, hyperarousal, and associated features. Combat Exposure Scale (CES) has a 9 percentage. The CES is a 7-item measure for wartime incidents of wartime stressors. Each item is measured on a 5-point scale ranging from no 1 to more than 50 items 5.